So this is a global multi-center single-arm registry investigating the use of the LUTONIX drug-coated balloon for the treatment of dysfunctional fistulas and grafts. It was initiated like a couple of years ago, and there are already 324 patients recruited, and this is the biggest study in recruiting DCB in patients, and we presented 6 months results today. So there were 324 patients from 25 international sites. So it was not only Europe, but also Taiwan, Singapore, so many different centers around the globe. And we think this is important because then you can get into a proper subgroup analysis. The sample size is huge. So I think a lot of interesting subgroup data will come up from this. So today we presented the final 6-month results on the LUTONIX Global AV Registry, and we just gave the audience a taste of the subgroup analysis that will follow. So we've seen some technical aspects considering the procedure. So we came up with the result that there is a significant difference in favor of the cases where a proper vessel preparation was performed. And also that it was very important the time of inflation. So we had a significant difference in favor of the cases that they were more than 2 minutes. So as I said before, this is the biggest registry, the biggest number of patients receiving DCB technology for AV. Yeah. That's the one thing. The data are more or less consistent with the rest of the data published before by Dr. Teratola and the AV-ED trial in the United States, and our retrospective analysis from Patras. So it's a 75% 6-month target lesion primary patency, 73.5 if you include the central veins, which we know they have a deficit compared to the outflow vein stenosis. So I believe that drug-coated balloon give you a benefit in terms of patency, and I think it's worth it to go to have your own analysis in your department and see if it gives you a benefit. You really need to go on and use. A 75% target lesion primary patency at 6 months is a significant patency rate. In our practice, we use drug-coated balloons in AV every time we perform an angioplasty, excluding the cases when we're treating grafts within the fabric. So it makes sense that you can use a DCB every time you have stenosis or restenosis.